During the past year, not only have communities of color been inordinately affected by the COVID-19 pandemic, but the events surrounding the murder of George Floyd exacerbated mental health struggles. July is Minority Mental Health Awareness Month, and the AHA is marking it by continuing dialogue with providers, clinicians, and experts on how to reach specific communities and increase access to care. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter with AHA. In this episode, Leon Caldwell, Senior Director of Health Equity Strategies and Innovation for the AHA's Institute for Diversity and Health Equity, is joined by Dr. Karriem Salaam and Dr. Kesha Clarke. These experts will provide context for the current issues in historically underrepresented mental health, talking about how we can do better and where to find resources as clinicians and patients.
Thanks, Tom, and welcome, everyone. I'm Dr. Leon Caldwell, Senior Director of Health Equity Strategies and Innovation for the American Hospital Association Institute for Diversity and Health Equity. Today, I'm joined by two colleagues with extensive backgrounds in both behavioral health and diversity issues. First, I'd like to welcome Dr. Kesha Clarke, licensed clinical psychologist at the Philadelphia VA and a clinical associate of psychiatry at the School of Medicine at the University of Penn. I'd also like to welcome Dr. Karriem Salaam, medical director for adolescent services at Friends Hospital in Philadelphia. He's also a clinical assistant professor of psychiatry at Drexel University School of Medicine. Welcome to you both.
Thank you for having me, Dr. Caldwell.
Thank you for having us. Welcome, Dr. Clarke. Thank you, Dr. Caldwell, and thank the team from the American Hospital Association.
Thanks very much for taking time for this very important conversation. You know, as you both know, this month is Minority Mental Health Awareness Month. There's several pieces to this month that we are trying to unpack in our short time together. And there's these unprecedented experiences in our country of a pandemic and societal movement towards social justice. From your perspective, how is this societal double whammy, this collective trauma and COVID-19 impacted the mental and emotional health of many communities who have been historically marginalized in our country? Dr. Clarke.
So the historical significance of the pandemic and various milestones in the social justice movement, to include prolonged periods of protest and civil unrest during the last year, have weighed heavily on African Americans and other marginalized communities. It's been devastating in one way and more of the same in another. Disadvantaged communities have had to deal with social injustice while struggling to maintain all aspects of life for so long, much of which is carryover from intergenerational trauma and the impact of being marginalized for generations. We shall overcome is a mantra that is not new to most marginalized communities. For instance, we already know studies that have confirmed that racism has a significant impact on the mental health of Black people and the other groups outside of the majority. We also know that the violence inflicted on and observed by marginalized communities place people at an increased risk of post-trauma response. Secondary exposure, unfortunately, may have a similar impact. So if you're in a community who's exposed to violence and then you witness videos that constantly play, in the media or on social media, we can expect that there is going to be a significant impact there as well. This is a phenomenon that researchers found following several mass casualty events, like 9/11. The history, along with several other factors like inequities revealed during the pandemic that played out on based on class, to include disparate levels of testing, and then later, differences in groups based on, in vaccination rates based on a disadvantage, differences in who was considered an essential worker and who was then at increased risk for contracting the virus, loss of jobs and income that disproportionately impacted non-majority groups, taking into account the inequities noted and who had the resources and infrastructure to even just continue their medical care through telehealth or schooling, or working virtually when we abruptly had to change to this modality, and our services were being doled out differently. the need to protest, and possibly be at increased risk of contracting a virus during a pandemic. Even though each of these issues were considered a matter of life or death, for some of us, we had to prioritize protesting, even though it put us at increased risk. And in addition to all of that, there was an expected uptick in anxiety and fear associated with the pandemic. There was an uptick in grief associated with loss associated with COVID-19, and all of that disproportionately impacted Black America as well as other marginalized communities. And so early stats basically reveal that these marginalized groups, African Americans and others, are screening at double rate for anxiety and depressive symptoms, but also recent studies have shown that third-fold increase has been found in mental health concerns and psychiatric symptoms across all Americans. And of course, that disproportionately affects communities with limited resources and the marginalized communities. So unfortunately, this is in the context of historically based concern about seeking mental health treatment with lacking resources, poor access to needed treatment, and ongoing stigma associated with mental health care that unfortunately was seen in the clinic all throughout the year. One of the things that I noted is that people were presenting for mental health services for the first time because of unchecked anxiety and unchecked ability to manage their stress. And unfortunately, in many cases, what we've seen is that that most people are not presenting for care, or that there's no access to care in general.
Thank you. Thank you so much for that. Dr. Salaam, Dr. Clarke noted several, nuances, if you will, of what our experience has been. And I say our, meaning our collective experiences, and even nuances that have impacted African Americans in particular. And if you add in the recent uptick in violence against Asian Americans, you kind of see that there's a trend for other groups who've been marginalized or are on that list of historically marginalized. They too have had aspects of their health, their mental health in particular, making them more vulnerable. You specifically, your services and your work is a lot around children and adolescents. So tell me about what's going on with our children. What's going on with our adolescents? How are they experiencing, in your words, in terms of mental health? How are they showing up?
Well, listen, that's an excellent question. And, I'm blessed in that I get to work with young people, but COVID has wrought significant havoc on the lives of young folks. So adults are kind of measured and judged by work. Kids are measured and judged by school. And so COVID has really transformed the way education is delivered. And many of us, many folks in general have not lived through a pandemic. A pandemic is a once a century event. And so we've had the benefit of attending school, but if you look at these youngsters today, and I really encourage us to give them some grace, their school has been ripped away from them due to a pandemic that's out of their control and out of everyone's control. You've taken away their social outlet. So kids spend more of their waking and productive hours in school versus at home. So you've deprived them of that. Also, many school serves a number of different functions depending on communities you're coming from, and particularly communities of color that may face different challenges in terms of resources. You have some families that rely on school to provide even meals, whether it be breakfast and lunch, and so that's taken away. I think Dr. Clarke mentioned that some families lack the resources or the social infrastructure and the technology to deliver the educational service. So you have folks who don't have the technology to, or Zoom or whatever educational platform is being used to deliver the educational service. And then you have a number of kids who have withdrawn from school altogether and they're unaccounted for. In addition to that, school is a setting of some pretty significant milestones that we may take for granted because we're so far removed from it. But let's say you're a graduating 8th grader transitioning to high school, or you're a graduating senior transitioning to life after high school. I'm sorry, did I say a graduating 8th grader transitioning to high school, or graduating senior transitioning out of high school? So those final athletic competitions, musical performances, things as mundane as having your yearbook signed, saying goodbye to your friends and your teachers, all that is gone, okay? And those are very important milestones. In addition, in the setting of the pandemic, folks have more fundamental worries like, am I going to live? Am I going to, if I live, am I going to live? Am I going to be ill? Am I going to be hospitalized? If I'm in a service profession where I'm doing forward-facing work, will my finances be impacted, and how will that affect the family? Also, in the setting of COVID, you had the restrictive measures, whether it be mask wearing, physical distancing. You have families who may live in a more densely populated area spending more time together that they didn't really plan for, right? And then folks have more disposable time. So that's time to engage in behaviors that might not be productive. So if you have more alcohol around the home, perhaps that's being consumed. Perhaps you're consuming more food than you would have otherwise, and that could affect your weight and your metabolism, and that could have health implications. So all of these things could impact the family, and it could impact young people as well. Finally, in terms of COVID, right, it's the novel coronavirus, so it's kind of a new entity, and we don't know when this is going to end and what's that going to look like, and will we ever return to anything that was once defined as normal? Like, will you be able to shake hands again? Will your kids be able to, play with their peers again? That kind of thing. So those are important. Add to that, in the setting of social injustice, let me take a quick step back from that. In the African American community specifically, the loss of life at the hands of vigilantes or police, that's not a new phenomenon. I think what was different about George Floyd is that it was captured on video. So it really showed the lack of humanity towards Mr. Floyd. And add to that, he wasn't the only one. There was the loss of Breonna Taylor. There was the loss of Ahmaud Arbery. And Breonna Taylor and Ahmaud Arbery, they were very young. You had others who were even younger than them, Tamir Rice, Trayvon Martin. And so if you live in neighborhoods where there's a heavy police presence, if you're a youngster from a neighborhood like that, you may wonder, will I be next? Will my loved one be next? And if something like this happens, could our lives be taken with impunity? And does that say something about the value of my life? So there's some folks who may have a sense of a foreshortened future in the setting of the twin pandemics of COVID-19 and the social unrest. It's almost like, here we go again. There's a new hashtag. However, I don't think all is lost, because if you look at the history of people of color in this country, nothing was ever given to us. We've always had to fight for our rights, and this is an extension of the civil rights struggle. And so we're not hapless victims here. And getting out into the streets and protesting and making sure your voice heard, those are action steps you could take to affect the change that we need. So, there is a silver lining there, and there is an opportunity for us to transform this society, and young people play a role in that.
This is very it's very helpful. Thanks to both of you. What you point out is, I get a sense of kind of anxiety is the key word. I was almost getting anxious as I heard both of you kind of describe what we've lived through for the past 18 months or so. What does anxiety look like? How does it show?
Well, we recognize, what the physiologic symptoms are of anxiety and how that will present, right? Those physical symptoms that people typically will report, typically people will even describe going into a panic state where they're just feeling like they're going to lose control. They're having difficulties breathing. They have, tightened muscles or chest pain. However, when I think about how it shows up in our communities, particularly in response to things like the violence, the social injustice and things like that, what you start to see is just hypervigilance. Feeling like you have to be on guard at all times. You see this sort of fear of certain situations. I can't tell you how many times I've had patients talk about how a police car was behind them and may not have even been a car that was intended to pull them over, but just seeing those lights put them on alert. And how they just froze or they started to sweat profusely. So you just get this hypervigilance. You're just constantly on alert. You're constantly looking around to see if you're in danger. You see a lack of trust. You see just difficulties trusting the systems that are around you, or difficulties trusting the people that are at your work or are in environments where you're finding yourself having, that you may spend even a majority of your day in. So that post-trauma response may be the way that anxiety shows up, basically.
That's pretty. That's helpful. Dr. Salaam, you've had a lot of experience, and even in your own private practice, your work as an author. There's a lot of this conversation in workplaces. I really like the way you set up that for adults, they have work, and for children, they have schools. Like you give it a place in which people kind of grow and develop. And you think about these places, how might this hypervigilance that Dr. Clarke alluded to, how might it show up in the workplace? What might it look like in the workplace? What might it look like even in virtual schools?
So again, Dr. Clarke, she very aptly described this hypervigilance, and I liken it to an alarm system. And an alarm system is meant to function when there's an abnormality in the environment. So there's a high concentration of smoke, and then the smoke alarm deploys. Once that concentration of smoke is diminished, then the alarm should shut off. But if you're anxious and you're tense and you're always on edge and you have an excessive sense of worry and fear and a preoccupation and a preparedness for impending harm that might not be, but based on your reality and your experience, it's occurred all too frequently. So you're hyper prepared. And so you're prepared to fight or to flee. And so your muscles require more oxygen. So your heart's going to pump. You're going to breathe more deeply and heavily. Again, that system is meant to function for short bursts until the danger is gone. But when that system is constantly or chronically activated, that could cause a phenomenon called weathering. And it really results in premature aging, and it has effects at the cellular level. And this phenomenon is also linked to race. And so there's some literature to support this, particularly in folks of color who've immigrated to this country. Let's say you are a person of color from Africa or the Caribbean, and you didn't share physiologic characteristics with African Americans who've been raised in this country. And then after living here 3 to 5 years, you have hypertension, or your risk for autoimmune diseases like diabetes. Let me take that away. Diabetes is not fully an autoimmune disease, but your physiology could be altered in the setting of just the racial climate in this country. And so, that could have profound impacts even at the cellular level, and it could affect lifespan, and it could affect your ability to perform tasks at work, especially if, at work, you should be focused on what's before you, and you shouldn't be preoccupied with what could happen. But in the setting of this social injustice in this climate, and you're constantly on edge, it could really interfere with your ability to complete these tasks at work, because we all have limited bandwidth.
You both are practicing clinicians, right, and professors. I'm curious, in our kind of our last part of this conversation, how are you guys taking care of yourselves? You both have families, and you have you're working, you're in society, you're in communities. Like, how are you guys doing? What have you been doing to take care of yourself?
Well, here, I'll take a stab at that one. So I think we're talking about self-care, which, I define as a collection of practices to really preserve yourself emotionally, intellectually, so that you could really function at your best in all spheres of your life. And self-care is exactly that. It's something that must be done by yourself, for yourself, and it can't be done for you. So number one, it has to be prioritized, it has to be defended, and then it has to be completed or executed. You have to get it done. And so self-care is more effective if it's part of a routine, if it's part of a habit, kind of like you brush your teeth and you shower every day. So your self-care should really be ritualized, so that without it, you don't feel right. And whether that be prayer, meditation, exercise, having conversations with your family and friends, but really carving that time out, especially if you're in the serving professions, and if you're in mental health, you're dealing with other folks' pain, and oftentimes broken lives. And prior to becoming mental health professionals, we were human beings, and we still are, with vulnerabilities and emotions. And so those things could affect us. So we need a break from them. So, many of us work in situations where we get paid time off, and you should take that. I view time off as part of my self-care, and that makes me a better physician. That makes me a better mental health practitioner. And then there's some simple things that could be done. If you live in an environment where there are parks and safe spaces to walk, then go for a walk. You're getting exercise, your skin's exposed to the sun, producing vitamin D. And oftentimes, if you have a family, you and your spouse, partner, significant other, or loved one could take that time to be away, from the minors in the home, and you could kind of have, unedited or uncensored conversations, which could be really refreshing. And again, the importance of stepping away from your work, if you have the benefit of time off, is an opportunity for you to rejuvenate and restore, and to put you in a position to be a better practitioner and provider of your craft.
Thank you so much for that. So, Dr. Clarke, how about you? What's been some of your rituals?
Yeah, I think Dr. Salaam actually covered it all, but I'm going to recap some of that. So we do know that there are so many behavioral strategies that we can use to manage our anxiety, our stress, and our mood. And in a context of so much stress and the stressors that are outside of our control, to include an increased demand of our services, because there are so many people in need of healing, it's necessary for us to devote time to managing our stress. We got to dial down the autonomic nervous system by practicing restorative and relaxation strategies that work. And ultimately, you have to do what works for you. We each have different needs. Some of us may need to engage others. Some of us may need to make that plan to dial back. It's just important that you come up with a plan. And for me, particularly during a pandemic, when I recognized that I was going to be on kind of an unending cycle of being home but working, I needed to develop a really specific daily routine that included, actually just the basics that helped me to feel good about my own self-care, but also even just watering the plants and making that a meditative practice. I did prolonged meditation exercises. But another thing I had to do is I had to set some boundaries because at some point when you don't have a commute, you create this kind of atmosphere where you can do these endless Zooms, one meeting after the other without a break. And that's just simply not healthy. So for me, I had to set some boundaries. Again, what's important is that you come up with a plan that works for you. And there are some basics that you can consider. So for instance, you got to take care of yourself. And what that includes is coming up with a schedule to eat, sleep, hydrate, and manage medical issues. I do think it's important that even in the midst of stress, that it's important to live a good life. And the pandemic made that really difficult for us because a lot of our social activities were cut down. And so you have to determine what it is that you still could enjoy under increased demand or under circumstances like the pandemic. As Dr. Salaam was saying, just even going for a walk, was that something that you could do for yourself? But fun activities in general. I know for my family, we did more game nights and we started exploring more games. And we actually went online and found lots of games that we had never heard of before and learned them together. So you may have to be creative. It's also important to regulate your emotions during this time. And I think sometimes that means for people that we're emotionless, but it's not the case. We have to acknowledge and validate that lots of things that are happening around us will cause us to feel. We are feeling, beings. We feel. And so it's important sometimes to validate how you feel, what's causing you to feel that way, and sit there with it, be there with it, be mindful about it. Share it if you need to, be personal about it if you need to, but it is important for you to feel, but then regulate. And so if the emotion is too intense, or if it's impeding something that's really important, you may need to then do something extra to manage that emotion. But it is okay to feel, particularly during a time where there's so much going on. It's important to balance thinking. How we talk to ourselves again can help us to either manage emotions or may cause our emotions to spin out of control. And so it is important at times to take a step back and put things into perspective. Unfortunately, under the pandemic, I think that many of us were in isolative situations and we may not have had the same kinds of feedback that we were typically used to. For me, I had to ensure that I was actually reaching out to talk to people that I trusted, and people who that had a balanced sort of opinion or balanced thoughts about what was going on, so that I could bring things back into perspective for myself. For instance, when in the last year, racist incidents were at its height, it started feeling like things were going backwards and we weren't going to regain that ground. And so it was important for me to be reminded that there were just as many people across the world supporting and working towards, for instance, racial justice and social justice, that I needed to know that we weren't going to be in this state forever and that we were going to continue to move forward if we, in fact, continue to maintain our own strength and do the little things that we needed to do every day, but also support the efforts of so many around us. It's also important to establish and maintain a community of support. I think that in general, we're going to find ourselves in difficult situations, and it is important to draw nearer to those who affirm us and people who can be available to us to provide us that necessary feedback. And if there is no one, if there absolutely is no one, of course, it's not, it's not recommended that you go at it alone. And so this is when, even though we're the mental health professionals and even though we're the medical professionals, we at times need that support, help, and assistance ourselves. And so that is the moment when you need to reach out and you get your own psychotherapist or you get others that can advise you professionally so that you can get where you need to go.
Wow, thank you so much. That was so rich. I feel less anxious now listening to both of you. And it was really those concrete steps. And I really like to thank Dr. Clarke and Dr. Salaam for this moment, this attention, and sharing with us both your wisdom, your expertise, and your compassion for not only your craft but for humanity. Thank you so much for your time today and engaging this very important discussion regarding behavioral health and diversity issues. To learn more about how the AHA is partnering with member hospitals to address historically underrepresented mental health issues in people and communities, please visit the resources located on the Institute for Diversity and Health Equity's website at ifdhe.aha.org. This is Dr. Leon Caldwell signing out. Thank you so much. Peace and progress.